right, good afternoon, everyone, and welcome to our town hall for Kentucky Electronic Visit Verification, the Theraps EVV solution for Kentucky providers. We are excited to have you guys with us, and a healthy welcome on behalf of Therap for all of you to 2024, as well as to our first town hall post go live. We are very excited to spend a little time this afternoon celebrating a successful go live that we had officially beginning last Thursday, 12/28, and then with the expectation for all providers in the state to be collecting EVV data beginning this past Monday, January the 1st, 2024. So thank you for all of you guys for the attention and the work that's gone in to preparation for Go Live. And for those of you that have been out there collecting data, one of the things that we're going to be doing today is taking a look at some of the statistics that are coming in, and also provide you guys with additional guidance from the state around expectations for EVV collection, as well as to do a little bit of troubleshooting and discussion of some issues that we know have popped up over the last couple of days around understanding once visits are coming into your system, how to interpret that data, how to address notices you may be getting around invalid submissions, things of that nature. So again, we appreciate you guys joining us for the town hall today. As always, we do have a dial-in option. If you were to get disconnected from your network, we certainly encourage you to use that, utilizing the phone number that you see on your screen. We also make available through the Zoom platform a chat icon where you can chat with our team. We've got a healthy group of folks on here keeping an eye on this, making sure that we're helping everybody troubleshoot their access to the webinar and the information. So if you can't see, can't hear, those kinds of things, please feel free to submit a chat and we'll have somebody help you out. Also, perhaps as important as anything else, we want to make sure you guys are aware of the question and answer icon, the Q&A icon you see as part of your Zoom platform. A big part of what we do here on these town halls is try to address the questions that you guys may have. We're going to provide you with a lot of information of our own, but we want to make sure that you have an opportunity to ask questions as well. So we encourage you to keep an eye on that Q&A platform to submit your questions. Again, we've got a team both on the Therap side as well as the Commonwealth side, keeping an eye on those submissions, making sure we get answers to you. We will try to answer them as timely as we possibly can. But if we have a few come in for which we're not able to submit the answer before the conclusion of today's webinar, we do aggregate those and get them up on our site. We'll also share any new questions and make sure we discuss them on the next town hall exactly 1 week from today. So please take advantage of that, as we want to make sure all questions get addressed as quickly as we can. For your presenters today, a couple of familiar faces, certainly myself, Jason Laws. I'm Therap's Director of Quality and Data Initiatives and one of our team leads for the implementation of the EVV project here in Kentucky. Good to be with you guys again. I am also joined by Stephanie Norton, our Assistant Director of Support for the state team and EVV Specialist Extraordinaire. I know you guys have heard a lot from Stephanie over the course of the last couple of weeks in preparation for Go Live, and today she's going to be sharing with you some troubleshooting activities you can take part of to address things like invalid visits coming into the system, and exactly what to do with those notifications that you're getting on your dashboard. So certainly we look forward to hearing from Stephanie very shortly. So again, our timeline or our agenda for today is just some quick touching on timelines. Fortunately, we're basically at the end of the timeline now. We've officially gone live. We'll do a quick review of that, a quick review of the onboarding options that you guys have had, and a refresher of how that works. But then we'll get to the core of what we want to do with our town hall today. Again, that is to review expectations for EVV usage by the state of Kentucky. We're going to talk about some of the statistics, what we've seen coming in thus far in our stats, and then we're going to take a few moments to talk about some issues and troubleshooting that you can do with those invalid visits. And then we'll take just a minute to talk about what's next. What can you expect over the course of the next couple of weeks as you're getting deeper into your utilization of the system, the type follow-up that you're going to get from us. Certainly the support of the provider network does not stop on the Therap side at Go Live. We're going to continue to be there for you all going forward in your utilization of EVV, but also in your ability to access and see data through the Therap aggregator. So I'm going to touch on that briefly today, and then expect that we'll have a little more information on that a week from today in our next town hall with the expectation that folks will have a lot more data in the system by that point. We'll then do a quick review of the questions that have come into the system or come in through the town halls, and we'll then do our wrap up. So that's our plan for today. And with that, we'll go ahead and get started. Certainly, I expect that everybody knows the information on here pretty well by now, but for anybody that's seeing this for the first time, again, Therap is the selected vendor for EVV for home health and personal care services for Kentucky. And we are focusing now on phase 1 of the implementation of this project, which focuses on the home health services that you guys are providing. The contract with the state of Kentucky does include a couple of things. Number one is access to the state the EVV platform that many of you guys are already using. It also includes the provision of an aggregator, which is essentially a repository for EVV data, whether you're using Therap's EVV platform or you're using a third-party system to collect EVV data. All of that data will ultimately end up within the Therap aggregator so that it can be used, aggregated at a state level, and used ultimately long-term to validate and or deny claims as they're coming in. As I said, again, the focus currently is on home health. We'll start looking into personal care services in the coming weeks. But for now, we're focused on HHCS, which officially went live last Thursday, December the 28th of 2023, along with the expectation that all of you guys in the state would be collecting EVV data as of this past Monday, which was January 1st of 24. We are now officially at the end of this timeline, having gone through all of our setup, all of our trainings and processes, and we got to that go live last week. So again, very excited to have gotten through this process with you guys, and do appreciate all the work that has gone in to getting you guys prepared and ready for utilization of our system. As I talked about before, you have basically two options as to how to approach EVV in the state of Kentucky. Option number one is the utilization of the Therap EVV platform, which has been made available to you all at no charge as part of the contract that we have with the state. You can utilize a mature EVV platform for capturing that EVV data. You also have as an option within that platform a mature claiming and billing system so that you can submit claims over to MMIS and or other payors, your MCOs. Wherever you need to submit those claims, we can submit that data to you, and this is available at no cost to you as a provider. The other option for those of you that have you already had in place or have a preferred electronic visit verification vendor, you do have the option of utilizing the third-party system to collect that EVV data. And ultimately, if you choose that option, you'll certainly continue to bill as you currently are, but you will then have that data flow over to the Therap aggregator. All of your vendors, you know, we've been in contact with all of them in terms of setting up those connections so that the data flows over to the aggregator. I think we've completed the connections for at least one of them, and others are getting pretty close in the near future. So we'll continue to keep you guys updated on that, but that is an option for you as well. Again, it is my hope that the message on the screen currently doesn't apply to very many of you, hopefully none of you, but in the event that it does, if any of you guys are seeing this information for the first time and have not yet done any type of onboarding, please reach out to us immediately through the email aliases that you see on your screen at kysupport@therapservices.net, as well as the state alias at medicaidpubliccomment@ky.gov. And with any of your submissions on there, we'd greatly appreciate it if you include your name, contact information, the name of your organization, as well as your provider number. That will make it that much more efficient for us to be able to follow up with you guys and get you the information that you need. All right, so with all of that out of the way, that's kind of the background information. Now let's get to kind of where we are. As we said, everyone was to have gone live officially last Thursday, but to be collecting data as of this past Monday. Those are the expectations from the state. So just to kind of review that, if your agency provides any of the services that you see currently on your screen, and these services are also clearly marked on the Therap EVV website, which we'll be taking a look at in just a moment. You can also find this data on the CHFS site which we're going to take a look at in just a moment. But if you provide any of these services, again, the expectation is that you should be collecting EVV data either via the Therap platform that's been made available to you or through an approved third-party vendor as of January 1st, 2024, which again was this past Monday. Now, having said that, there are also some expectations of the volume of data that you're going, and the threshold of data that you're going to be collecting going forward over the next few months as you continue to push forward into your adoption of the Therap platform or collecting EVV data through your vendor. In January of 2024, you are expected to be capturing at least EVV, or must use EVV data to EVV to capture data, I should say, for 50% of your visits. So at least for half of the visits in the month of January are expected to be collected through EVV. In February, that's going to bump up to 75% of your visits. So 3/4 of the visits in February should be collected through EVV. And then in March of 2024, the expectation is that by that point, 100% of the visits for those services that were indicated are going to be collected through EVV. Now, just to reiterate that and the message from the state, we have documented that on our site. You can easily see that on our Kentucky State page. You can click on this message from CHFS. Which will give you all of the information about EVV and the information that I just shared, including that list of services, including those thresholds, so that you know what the expectations are around your collection and of EVV data. That is easily accessible there. We've also put this data under our Kentucky EVV page on the Therap Services website as well. As most of you probably know, we've got a lot of different resources here on the site, but we have included that EVV adoption timeline for Kentucky providers here as well, so that you've got reminders as to what the expectations are around the collection of those visits. I can tell you, as you can see here, we've also included some resources, including some email aliases for you to use if you've got any questions or any challenges around that, as well as the phone number that you can call into if you're running into any problems. So hopefully all of that is review for all of you guys. And so again, just as a reminder, everyone should be collecting that data as of January the 1st. As we scroll forward now, I want to share with you guys kind of what the statistics are looking like thus far in terms of collection of data. At this point, since go live, we have data from 12 providers that are out there, and that's great. For those of you that are collecting that data, we're very excited to be capturing that information. That also means that there are some of you guys that have not gotten going with the collection of EVV data. And so we want to make sure that you guys are moving forward as quickly as possible. And if there are particular barriers in place, that you are letting us know what those are. I know our training team is following up with all of our providers out there to make sure you have everything that you need to answer any questions that you may have. But certainly if you don't feel like you're getting the support you need, please follow up with us and let us know, because we want to make sure that we're bumping that number up in the very, very near future so that folks are utilizing the system. Of those 12 providers, we can say to this point, we've got almost 200 slots. This 190 number, I checked in our system about an hour ago, so it may have gone up a little bit since then. But we do have roughly 200 slots. The overwhelming majority of the check-ins that have happened in Kentucky through EVV thus far have been through the mobile application, which is outstanding. It's to be expected. This is the ideal way to capture EVV data. So we certainly expected there to be the majority of the entries to come in that fashion. But there are a few entries that have come in other ways. As we've talked about throughout implementation, mobile is the desired method for submitting information, but in the event that that's not an option, we do provide some other options as well. One being the ability to do check-ins via web, which is Therap's browser-based application. We've had an entry come in that way. We've also had someone take advantage of our offline check-in capability, which is great to see. in the event you're caught providing a service in a scenario where you don't have network access, we do offer an offline option for you to be able to collect that data. And then we also have, as you can see on here, 14 manual check-ins, which effectively means someone has manually gone in and entered EVV data for a user rather than it being automatically collected through the mobile. So that's the data that we have to this point. The one other method of data collection not represented on here is the use of IVR, which is the telephone-based example, meaning you're able to call into a particular number to do your check-in. That is also an option as necessary if you want to tie that number to the check-in, typically done through a landline at the point of service. You can do that as well. If you need any support in remembering how to do that, please reach out to us and we can help you get that piece set up. But again, we're very excited to have the data coming in that we do, but certainly we're looking forward to adding these numbers and making sure that we're providing the support, best possible support that we can to you guys and anyone that needs assistance with getting onto the system. With that said, I want to kind of transition over now from the data that we have coming in so far over to some issues and some troubleshooting. And in particular, many of you guys who have been collecting data, you may have seen on your dashboards, the administrators within your organization, some notes coming in around invalid visits and wonder, okay, what exactly does that mean? And perhaps more importantly, what can I do about it? So given that, what I want to do now is turn you guys over to Stephanie to talk a little bit about kind of what that information is that you're seeing within the system and how you guys can address it so that your data has all of the necessary elements and then flows over to the aggregator. So with that, Stephanie, the floor is yours.
Thanks, Jason, and Happy New Year, everyone. Thanks for being here. Want to address the invalid visits that you might be seeing. So I want to talk about what those statuses actually mean. So you're collecting that EVV visit information inside of our TheraP system, and our TheraP system is sending that data over to the state aggregator. Initially, when we were doing the setup with you, we prompted you to fill out some information on the staff, their social security number, on the individuals, their residential address, their Medicaid ID, that kind of stuff. So now the system is checking for those things. Those are identifiers in the aggregator. So you may be running into some invalid visits, which is just letting you know there's some things you need to correct in your account. So when you're seeing those invalid visits, it means there's an edit required on your part. Invalid means our system has checked for the requirements and you're missing some of those minimum requirements. So we're holding those visits until you get that information updated, and then it'll go back over to the aggregator. You may also see that visits show up as validated. Validated is great. It means it's past those minimum requirements and it's in the queue to be sent to the aggregator. So usually you'll see visits that are validated will show up later as accepted, which is our end goal. We want all those visits to be accepted. That means the data has gone over to the aggregator and has been accepted. These are the primary statuses that we're seeing right now. It is possible to get a rejected status as well. But since we're not seeing any of those yet, I just wanted to focus on these primary statuses. So where you will see this in your account, a majority of you are going to be seeing it on your to-do tab. If you are an admin, when you log in, you'll have to click on that to-do tab on the left-hand side of your dashboard to be able to see this count here. You could click on the word visit or on that number of visits that's listed there, and it's going to give you a list of results. There's a blue border up at the top that has all the different column headers, and these two column headers are the ones that you would really want to focus on. The status, which would either be invalid, validated, or accepted, and then the validation message. If you are receiving an invalid, the validation message would tell you what you need to fix. You can also see this from your admin tab. So schedule admin users, not everyone will see this, but if you're a schedule admin, you will get those notifications on your to-do tab. You can also access it from your admin tab under that scheduling section, which is at the very bottom of the screen. under TheraP EVV visit search. So you could search for up to a month at a time. And again, you're going to get that results list. Those are those two columns we want to pay attention to. And here's an example of an invalid that is showing it's because of the Medicaid ID. You may be getting this message that the Medicaid ID has to be in 10 digits. You may not have 10 digits. That's something that has to be fixed in order for that visit to be able to go through to the aggregator. So I've looked in the accounts for people that are collecting data, and these are the most common reasons for invalid visits right now. So I'm going to talk through these and then show you how to resolve these. A lot of times we see this in new accounts that are going live for the first time. And once you resolve these initial issues, the data will just continue to be sent to the aggregator and show up as accepted. So, this shouldn't continue to be something you have to work at clearing invalids. If you get that cleared initially, then the data will be moving on to be accepted. So one of the criteria for the aggregator is to have a unique identifier for the staff or the user. And so that was decided it was going to be the social security number. You do not have to put in the full social of the staff. You could just put the last 4 digits, but it would need to have that leading 0 to show as a complete social security number. Another piece is the location is required. That's actually the geolocation that's for the individual's residential address. Again, that invalid individual Medicaid ID, it has to be 10 digits. Or in some cases, there may be a Medicaid ID that's completely missing. And then one other thing on the address, we've seen some where the zip code is missing. So these are the primary issues right now, and I'm going to walk you through how to troubleshoot those. So we're going to start by looking at those staff or users and where to add in their social security number. So this is something that you would do from your admin tab under user list. And I'm going to go ahead and switch into this demo account to show you. So user list, I can use this field up here to search for the user, or I can just click to open. What we're looking for is down here at the bottom where it says go to personal details. So this personal details page is where that social security number field can be found. And you would want to see the last 4 of the social with those leading 0s. You don't have to put in the dashes, but it does need to be enough digits to equal a full social security number. Once you have updated that to make sure it's there, you would then go back in and resubmit the visit, and I'll show you how to do that in a moment. There's a quick way for you to be able to see who is missing social security numbers. So if you go to your agency reports tab on the left-hand side of your dashboard, we're going to look at the report library, and I'm going to click view. And I'm just going to type in up here where it says report name. I'm going to type in user and search. So it's showing us we have 23 reports here with user in the title. It's only showing us the first 15, but I can go to the second page here, and this is what I'm looking for. User detailed information with social security number. And if I just click on that, it's going to run this report for all of my users. And there's a social security number field here. So anyone that's blank, if they are delivering EVV services, they are the service provider, you need to have their last 4 of their social with leading 0s in here. This is something that you can export to Excel if you want to have this list so you know who you need to go back in and correct. So we can't add it from the screen. This is just a report on who does have socials or who's missing socials. But as a reminder, back on our admin tab under user list, that's where we're going to go to add that social under the personal details. All right, so that's one thing that you may need to resolve. Before I show you how to resubmit those visits, I'm going to walk through those other issues as well. So for the other common issues that we're seeing, location required, individual Medicaid ID, and that zip code, we're going to access that from our admin tab under the care section. We're going to click on that individual demographics list. So again, I'm going to go back to our demo account here and show you that on my admin tab down here under this care section, individual demographic list. I can use this filter to type in the name of someone that I'm looking for, or I can just scroll down and find them. So I'm going to click on this first individual to open them up. So I can see I do have a Medicaid ID here, but it's only 8 digits. So this is going to require me to make an edit. I can also see down here at the residential address, the location is missing. So those are two things that I would need to correct. When you're on this demographic form, if you scroll all the way down to the very bottom, you'll see an edit button. So this is going to open these fields for us. So I can come in here and correct my Medicaid number. Maybe I forgot those leading zeros for my Medicaid ID. So that's going to make it 10 digits. I'm also going to come down here, and for the location, I'm just going to click on that pin and search for this location. This is going to find this address on the map. And then I can click to use this location. It's going to capture the coordinates, so the latitude and longitude of where this address is on the map. So where this will come into play is when you're doing your check-in and check-out, it's going to be comparing the location of where staff are checking in and out to the location of where their residential address is. And just a reminder, we did have a question about this in the Q&A. When staff are doing that check-in and check-out, it's not always going to be 100% accurate with the exact street number or house number. It may show the house next door or the house across the street. So just know that there is that comment box that your staff can use to leave an explanation or a comment if that location is inaccurate. So once you've added that location, that little pin will turn green, letting us know that that is there. And that other common invalid message we were getting was about the zip code. So just remember to check and make sure that you have all of those fields completed. And then I'm going to click update. It's telling me that's been successfully updated. And I have a shortcut here to go right back to that list of all my demographic data. From this view, you can actually see the Medicaid number here, and I can see if someone is missing that Medicaid ID completely. So this is another instance where I would want to come in, do that edit, and then put in that Medicaid ID. Once you've made those corrections, you can then resubmit that data. I'm going to switch back over to my slides here and walk you through that step. If there's any questions that are coming in, Jason, that we need to address, just let me know. So we've made our corrections. We've added our social security numbers for our users. We've updated the demographic data for those individuals. Those visits are still going to show as invalid. The fastest way to resubmit is to do a bulk resubmit. So once you've made all of the corrections, then you can come in and just send all of those, resubmit all of those visits all at one time. So again, only available for those users who are schedule admins. On their admin tab, back underneath that scheduling section at the very bottom of the screen, we would be looking at the TheraP EVV visit bulk resubmit. It's going to ask you for the date range that you want to pull. And then once you put in that search for your dates, it will display all of the invalid visits from that date range. So the nice thing about this is if you've made all your corrections, then we can just check this box up here in blue and it will select everything. And then I can click resubmit down at the bottom there. If for some reason you've forgotten to correct something, that visit is going to return as invalid again. So anything that's invalid, remember, it's requiring action from your part in the TheraP account. And then once you've made that correction is when you would do your resubmission. The nice thing is, once we get these initial errors cleared, those visits are going to be going through automatically. You don't have to do anything other than collect the data for that information to go through. You may run into invalids again in the future if you add a new staff person and forget to put in their social, or if you add in a new individual and forget any of that demographic data there. Looks like there's a question in the chat. Do we need to continue to check the validated visits to make sure they change to accepted? So that's a really good question. It usually takes about 30 minutes for a visit to move from validated to accepted. What will be important is when you get ready, when the state is comparing your claims to these visits, is to make sure that all of your visits are accepted. So before you do that billing piece, coming in and doing a search, which you can just do that visit search and put in that date range and just confirm, are all of my visits in accepted status? If you're not seeing anything as invalid on your to-do tab, that's an indication to you that everything is accepted. But you know, it's a good habit to get in to just review your data to make sure that it is accepted. You can see in this screenshot, I do have a rejection. So, you know, that's something we'll talk about once you get through your invalids. There is a chance that something could get rejected, which again would require some action on your part. Any other questions that we should address about the invalid submissions and how to clear those? All right, I'm going to pass it back to Jason. And just a reminder that if you do have questions outside of this webinar, please get in touch with us at that kysupport@therapservices.net.
All right. Thank you, Stephanie. And thank you for all of you that are submitting the questions. I think we've gotten most all of them addressed. There was one that we think we know the answer, but the particular expert that I think can give the best answer on that, it wasn't able to join us today. So I'm trying to get an answer from them on that to confirm. We'll get back to you on that one as soon as we can and share out the response. But I just want to make 100% sure that I'm right before we do that. But again, I do appreciate the submissions that have come in thus far. And Stephanie, thank you for walking through that. Hopefully that addressed the questions and issues that any of you guys had through the invalid data that you've seen coming over. But certainly if additional questions arise, please don't hesitate to follow up with us and we'll be happy to kind of walk you through that. So the other piece that I wanted to mention today is kind of to expect what's next. Now, several of you are collecting data and starting to get more and more information in there. You're working through your invalid entries that are coming in to make sure that they are crossing over into the aggregator. So the next logical step is you want to be able to see your data in the aggregator once it's going across. And we're working on that on the back end right now. I've included a screenshot of the aggregator so you can kind of see what to expect, but we're going to be providing a lot more information about this next week. We're also going to be following up with you guys in the very near future. A couple of quick things that I did want to mention today. Some of you guys may remember this from some previous town halls. I know we've discussed quite a bit about this, but again, just as a reminder that the access to the TheraP EVV aggregator is going to be through COG, the Kentucky Online Gateway, which is the state single sign-on portal. So for many of you guys may have used that before for other things, other activities that you have to participate as part of being a state contracted provider. But essentially what it is, it's a central portal where folks are able to log in and then you can directly access the TheraP aggregator through COG. And so what we're working with all of you guys on right now is identification of who that particular COG administrator or who that particular person within the organization is going to be that is accessing the administrator. You can certainly have more than one. Basically, what our goal is to get the primary administrator created, and then you have the ability to go in and create additional users if you want to share that access with others. But folks typically fall into one of two buckets, which is kind of the two examples that I have on the screen, and want to make sure that you guys kind of know what to expect going forward. For those organizations who have identified their existing COG administrator, and what I mean by that is the person that is already on file in the COG system with the state as your COG administrator, if that is the person that will also serve as your aggregator administrator for TheraP, your access is going to be created and automatically linked by TheraP, and we're going to notify you when that's completed. So it'll be a very seamless process for those folks. Where there are a couple of additional steps involved are going to be for those organizations who have identified an alternate aggregator administrator from their existing COG admin. And what I mean by that simply is that the state has on record who the particular COG administrator is for your organization, and you would like it to be a different person within your organization who is going in and reviewing the data through the TheraP aggregator. If that is the case, then the existing COG administrator will need to create a COG account for the new aggregator administrator, and then we'll go in and put that new person in our aggregator, and it will link up with the COG ID. And I realize that the word COG and admin and aggregator and administrator get thrown around a lot, so it can be a little bit confusing. So we're going to be following up with all of you guys directly to kind of walk you through this process and make sure that you have the information that you need to be able to get these folks set up and get that access created. But I did want to kind of give you guys a heads up as to that's what's going to come next, and you are going to be able to hear from us, or you are going to be hearing from us in the very near future to get that done. So again, I know that Stephanie covered a lot of the different issues that some of you guys have been facing over the last several days with Go Live, but I also want to make sure you're aware of the ongoing resources that we have available to all of you guys. First and foremost being the alias that we've provided for all of our Kentucky users, which is kysupport@therapservices.net. If you submit that in, that will submit a case to our team that we will respond to. Most of the time we're able to respond immediately, so we will get back to you as soon as we possibly can to help address whether it's a data collection issue, or you have a question around invalid visits, or you haven't been able to pull the trigger on going live yet because there's a particular barrier in place. All of those are absolutely reasons to submit something through that alias and let us know, and we will follow up with you to get you the information that you need. We also have the Kentucky EVV support page that I'll pull up again here in just a minute. This is kind of a one-stop shop of resources for the TheraP EVV platform, including training materials, frequently asked answered questions, and those kinds of things. There's also a couple of resources that have been made available by the state. One being the 1915C waiver help desk at ky.gov. This is an additional spot that you can go to submit questions that are more appropriate on the state side. And then there is also a help desk associated with COG, which I was briefly talking about a moment ago, and the role that COG plays with the TheraP aggregator. If you're having issues with accessing COG, you can certainly write into the COG help desk at ky.gov. They also have a phone number available, and folks are there from 8:30 to 5 each weekday. So all of these are great resources that can assist you depending on the nature of the particular issues that you're running into. We do have a few frequently asked questions that have come in within our last town hall, as well as in some of the communication we've had with providers. So I wanted to bring them up here publicly so folks can see what the answers are. First and foremost, we had a question come in last week on our town hall that I don't think we were able to get a full answer out publicly, so I wanted to communicate it here. And that is there a forgot password option for the mobile app? Some of you guys may have seen within our application, we do have the ability for you to set up for a user to be able to go in and reset their password in the event that they've forgotten it. Unfortunately, that's not embedded within our mobile app. To take advantage of that feature, you need to access TheraP through the web browser. I provided the URL right here on the screen, and we've got this available through our materials as well. But certainly we'll make sure that this gets published out for you. But from there, you can go to that to reset your password if you were to forget it. The good news is, even though it's not embedded as part of the mobile app, this can typically be accessed through any browser on a typical Android or Apple device. So you should be able to get to that information. A couple of other questions that are related more to direct EVV and billing. We've had a question come in. Do you have to complete EVV for visits that are not billable, such as supervisory visits? And certainly from the therapist perspective, generally speaking, EVV is not required for non-billable services. But if you have a question about a particular service and whether or not it is required, we do encourage you to follow up with CHFS. In the instance of supervisory visits, typically that's more oriented towards the staff member providing the service than the service recipient, and therefore does not require EVV. But if there's any question about a particular service, we do encourage you to follow up with the state to get additional information about that. Somewhat related, is there a minimum amount of time that can be billed per visit? And the minimum amount of time for a unit of a service to be billable is going to vary according to the minimum requirements and the associated rounding rules for the particular service being provided. So given that, we have built those rounding rules into the EVV platform and our aggregator, so it's going to go over properly and get calculated properly. But if you have questions about the particular minimums for any of these services, we would encourage you to follow up with CHFS if there are any questions about these so that you can get additional information. But we have kind of baked those into the cake, so to speak, so that it will calculate your services appropriately based on the rules for that particular service. Let me check over and see. I don't see any other questions. It looks like Stephanie's been busy answering any of these questions over here. Is there anything else we want to discuss publicly, or I think you got all of them, didn't you, Steph?
Yeah, but there were a couple of questions that people were putting in about the GPS location.
Okay.
I did note that on a future town hall, we'll go through reviewing the data in your account where you can easily see those location discrepancies and how to add those exception codes. Someone did ask if the verification was required. And you may see that at checkout on the mobile app. There's a verify option where you can collect an electronic signature or a voice recording. That is optional, so it's not something that's required as part of Kentucky's EVV. But if you or your staff would like to utilize that, you can. You can only capture that within 15 minutes of checkout, so it won't be something that can be added after the fact. But that is not a field that's required for EVV at this time. And then Kim pointed out that with the new update to the mobile app, with the change in the login, since it's going to the browser, you do have that forgot password that shows up there if you're having trouble logging in. So thanks for that, Kim.
Great, thank you. And again, additional questions, archive questions can be found here through our site. I'll go over there again for you guys to see on our Kentucky EVV page. Again, all of these resources around kind of step-by-step instructions on utilizing different parts of the EVV platform. We also have a lot of resources that are tailored to particular roles. If you're more of the administrator role scheduling EVV, if you're a direct service provider, you can find the different support materials for your particular role and whatever it is that you're trying to do. So we encourage you guys to check that out. We also have additional training resources, fully asynchronous training materials through EVV simulators and a lot of other tools that can be extremely valuable as you're going in and getting prepped for EVV. Again, I know we've said this multiple times, but want to make sure folks do understand the resources that are available to you. And we do definitely encourage you to reach out at any point if you're having any issues. One is the KY support at therapservices.net alias. Please submit any questions, concerns, or issues that you're running in there, and one of our specialists will follow up with you. And as I said before, the state is also making support available through the COG. For those of you accessing the aggregator, we've got some contact information for the COG Security Help Desk as well. So please utilize that as needed. couple of key dates going forward we want you guys to be aware of. We've mentioned this a couple of times, but want to make sure that folks know that the state is hosting a post go live touch base with the stakeholder network that is out there. So that is going to be next Monday, which is January the 8th. That will be at 10 a.m. Eastern or 9 a.m. Central, depending on exactly where you are. I've included the registration link here. You can also find that information on the Kentucky site. We're going to be sharing out these slides publicly. Hopefully, we should be able to have them up within about 24 hours so that if you want to utilize the link embedded here to register, you'll be able to. And then next week, we are going to have our next town hall, same time. On Wednesday, January the 10th at 1 Eastern, where we're going to continue to walk through things around aggregator access and troubleshooting, and we'll certainly discuss viewing your data within the platform, being able to review. So the example that Stephanie gave around GPS location and making sure that you know where that information is getting collected at, we'll take a look at that information as well. So with that, are there any other questions? Looks like there was a question that came in from D. This was the one I was trying to get more info on. Kelly, I don't know if there's anything additional you want to add to that. Are you available?
So the only thing is, D, even if you're using the third party, you do have to use the Medicaid ID number to submit to the aggregator, because that is what the aggregator is looking for.
So hopefully, D, that addresses your question. But if there's any further information we can provide, please just reach out to us directly, and we'll be happy to set up a more in-depth conversation around your particular circumstances. Beyond that, I don't see any other questions that have come in. Let me go take a quick look in the chat. There we go. Now they've added that through the browser. Got that. Anyone else have any questions? It has to be the actual state ID number. Okay. If not, let me ask our friends from the state. April, anyone else? Was there any additional information we want to share from the state perspective before we close out today's town hall?
No, Jason, I think we're good. Thank you. I believe, though, there is one additional question, it looks like there, in regards to a question in our Q&A.
Yeah, it has to be the actual state ID number. It can't be the MCO number. I'm trying to get a little more context on that. Just to check. Patient has a Medicaid MCO. Additional Medicaid, correct. Okay, yeah, I mean, it looks like that's the actual state ID. It rejects. Let us look into that. I want to make sure that we've got all the information here. But Jacqueline, thank you for chiming in on that response around the MCO number. We'll make sure that we've got that in there properly, and we'll share the response out to that. So thank you, guys. All right. Beyond that, again, we appreciate you guys joining in. We appreciate those of you that are working hard to get the EVV going within your organization and collecting data. Others of you, again, the expectation is that you are going to be collecting that data immediately, effectively going back to January the 1st. And if there are any barriers, questions, issues, whatever the case may be, for which we can provide additional support to get you guys going, please do not hesitate to reach out to us. And so with that, again, thank you for your time, and we will close out today's call, and we look forward to speaking to you all next week. Thanks, everyone.